viewers, Noradli Amira binti Adnan.
Hi, my name is Nawati Kahani binti Abdul Razak.
Hi, my name is Farahusna binti Azman.
Hello and hi, my name is Siti Nuriza binti Jupri.
Hi, my name is Wan Anis Nabila binti Wan Abdullah Zawawi.
Hi, my name is Nurhanis binti Aziz.
Assalamualaikum and hi everyone. Today our group are going to present about radioactive in medicine. Generally, there are 4 content in this presentation. First, history of radioactive in medicine. Second, introduction and definition. Third, properties of radioactive in medicine. And fourth, application of radioactive in medicine. Hi, I am Amira and now I am going to explain about history of radioactive in medicine. In 1895, German engineer Wilhelm Röntgen was experimenting with making cathode rays, or rays of electrons. His device was blackout, but he noticed that a piece of cardboard painted with barium platinocyanide fluoresced or glow when it was placed near the cathode ray tube. So Röntgen set up another experiment. He blacked out the machine, turned the lab's light out, and saw the painted board was already glowing in the dark. Faintly sure but glowing. So Röntgen threw himself into investigating what he called them X-rays. He experimented with creating images of what he was seeing and at this point made now typical scientific move. He asked his wife for help. Röntgen wrote up his experiments in a paper called On a New Kind of Rays, and this paper earned him an honorary medical doctorate, the first Nobel Prize in Physics, 1901. In early 1896, at the Académie Sciences, French physicist Antoine Henri Becquerel heard about the discovery of X-rays. Becquerel realized using photography that some materials naturally give off spooky rays, like uranium left an impression in a photographic plate just by being near it. Some sort of energy was hitting the plate. This was radiation. Energy that comes out of a matter as it decays or breaks down into other smaller form of matter. Curie would later name this process of decay as radioactivity. Becquerel dove into research on radioactivity. He figured out that uranium emits rays that can be deflected or pushed around by electromagnetism. So there are a different form of radiation from X-ray which are not affected by electromagnetism at all. Becquerel also researched what happens when you mix radiation and magnetic fields, showing that radiation can have electrically negative, positive, or neutral charge. Becquerel's contribution to radiation studies were wide-ranging from basis to potential applications. When he accidentally burned himself by carrying around a piece of radium, he and other researchers conclude that radioactive substance might be able to burn bad stuff like tumors or might be have a medical use in fighting cancer. This continued the tradition of using radiation as a medical technique that Röntgen had started and the Curies would build on. Becquerel died in 1908 likely due to his work with radioactive substances. He was only 55 years old. He left behind a clear research question. What happens when matter radiates spooky energy? Enters Maria Curie, born Mary Sklodowska in Warsaw, at the time part of the Russian Empire. She went to a secret school called the Secret Flying University. She enrolled at the University of Paris and earned a degree with distinction in physics, basically a master's in 1893 and a second in mathematics 1894. After her first degree, she was hired to study the relationship between magnetism and steel for the Society, the encouragement of national industry, which she met Pierre Curie, who taught at the School of Physics and Chemistry. And it turns out both of them fall in love. Well, in 1895, Mary found out about Rontgen's and Becquerel's discoveries and being trained in the study of electromagnetism, formulated an experiment. She used a sensitive electrometer which measured electric charge and was developed by Pierre years earlier to test how rays producing uranium affected electromagnetic fields. She found that uranium gave off rays that made the very air conduct electricity. Mary created for the first time a theory of radioactivity. In some substances, atoms themselves must be breaking down slowly, releasing energy. And this theory became foundation for modern physics. In 1898, Mary and Pierre discovered element polonium, naming it after her oppressed homeland, and she isolated radioactive element radium out of uranium. Mary applied her theory. She used radioactive materials to treat a cancer. Pierre had the idea of implanting a small seed of radioactive materials into tumors to shrink them. And when the Great War broke out in 1914, Mary died in 1934 of cancer. In 1995, way after her death, Mary Sklodowska-Curie buried in Pantin, Paris for her own achievement. To make things more clear, you guys must hear the introduction of radioactive in medicine after this.
Now, I will explain about the introduction and definition of radioactive in medicine. Radioactive materials can be used to diagnose and treat ailments, as well as for medical research. These applications are governed by the Nuclear Regulatory Commission, NRC. The NRC's standards are intended to ensure that radioactive materials are utilized safely and in a manner that safeguards patients, medical personnel, the public, and the environment. Radiation or radioactive materials are used to diagnose or treat around one-third of all patients admitted to the hospitals. Nuclear medicine is the name given to the discipline of medicine. Radiopharmaceuticals are the radioactive materials used. A small amount of materials is injected, inhaled, or swallowed for diagnosis. The substance accumulates in the area under investigation where it emits photons. A gadget called as a gamma camera may detect these photons. Image captured by the camera can reveal information about the organ's function and makeup. They can assist clinicians in locating, identifying, and measuring malignancies, as well as viewing issues in an organ. For example, Technetium-99m is used to identify bone, heart, and other organ disorders. The thyroid gland is imaged using radioactive iodine. Radioactive materials are employed in therapy to kill cancerous tissue, shrink a tumor, or relieve pain. In nuclear medicine, there are three basic types of therapy. The first one is teletherapy. Teletherapy uses a strong beam of radiation to target cancerous tissue. One example employs the gamma knife, a device that focuses radiation from multiple cobalt-60 sources on a point deep without brain tissue. Second is high doses of radiation from materials injected into or eaten by the patients are used in therapeutic nuclear medicine. For example, Radioactive iodine can kill or shrink a damaged thyroid. The third is brush therapy. Brush therapy employs lower activity sources that are sealed in seeds that are implanted near or into malignant tissue, such as the breast, prostate, or cervix. The seeds are injected or surgically implanted, then removed when the patient has received the required dose. Intravascular brush therapy systems use catheters to insert modest doses of radiation into arteries. To know more further about this topic, let's see the properties of radioactive in medicine.
Okay, now let's continue with properties of radioactive in medicine. There are 5 properties of radioactive in medicine, which are alpha particle, beta particle, neutron particle, gamma ray, and X-ray. Alpha particle is a positively charged particle consisting of 2 protons and 2 neutrons emitted from the nucleus of some radioactive atom. An alpha particle is the nucleus of helium atom. Alpha particle cannot penetrate most of material. A piece of paper, the dead outer layer of skin, or even a few inches of air are sufficient to stop alpha particle. Beta particle is negatively charged, fast-moving electron emitted from the nucleus of various radionuclide. Unstable atom with a high neutron to proton ratio emit negatively charged beta particle. Beta particle can travel up to several feet in the air. Beta particle can be stopped by some plastic, aluminium, or a block of wooden. Beta particles should never be shielded by lead or other high atomic number shield, which could result in X-ray being released. Neutron particles that can be emitted from the nuclei of various unstable radionuclides. Neutrons are high-speed nuclear particles that are only type of ionizing radiation that can make objects radioactive. Neutrons have an exceptional ability to penetrate material. Hydrogen contained material are best for shielding neutrons. Gamma rays is high-energy electromagnetic photon emitted from the nucleus of an unstable excited atom. Gamma rays are pure energy that can travel a great distance at a high speed. X-ray is a high-energy electromagnetic photon emitted from outside the nucleus. The primary difference between X-ray and gamma ray is X-ray are emitted from processes outside the nucleus, but gamma ray originate inside the nucleus. Gamma rays and X-ray are very penetrating and can travel a great distance. Lead or concrete is able to reduce the intensity of gamma ray and X-ray. Now I will pass to the next presenter.
Now we will proceed to the applications of radioactive in medicine. There are many applications of radioactive in medicine. One of them is practice of diagnosis. Radioactive in medicine can be used in order to diagnose a wide range of conditions. One of the most common methods is radiopharmaceutical or oral route. What is radiopharmaceutical? Radiopharmaceutical is substances that are used to diagnose and treat medical conditions. There are a few ways radiopharmaceuticals may be given to the patient, for instance by mouth, injection, or placed into the eye or bladder. The dosages of radiopharmaceuticals used to diagnose medical problems are vary depending on the type of the test. The amount of radiation received from these doses may be similar to or even lower than that received from an X-ray study of the same organ. Diagnostic radiopharmaceuticals can be used to track blood flow to the brain, liver, lung, heart, and kidney. After receiving radiopharmaceuticals by mouth, injection, or placement into the eye or bladder, the patient is usually asked to lie down on the table while a camera takes pictures. The doctor will be able to see what kind of problem there is and where it is by focusing the camera on the area where the radioactive material is concentrated. Positron emission tomography, PET, and single photon emission computed tomography, SPECT, are two types of imaging techniques that are used. A PET reveals metabolic or biochemical function of tissues and organs. It detects the pair of gamma rays produced in the body tissues by the interaction of a positron and an electron. The electron and positron cancel each other out, resulting in two gamma rays traveling in opposite directions. PET detects electronic signals by converting the energy released by gamma rays into ionization crystals. Meanwhile, SPECT is a nuclear imaging scan that integrates computed tomography and a radioactive tracer. The tracer is what allows the doctors to see how blood flows to tissues and organs. Before the SPECT scan, a tracer will be injected into your bloodstream. The tracer is radiolabeled, meaning that it emits gamma rays that can be detected by the CT scanner. The computer collects the information emitted by the gamma rays and displays it on the CT cross-sections. These cross-sections can be added back together to form a 3D image of your brain. The radioisotopes typically used in SPECT to label tracer are iodine-123, technetium-99m, xenon-133, thallium-201, and fluorine-18. These radioactive forms of natural elements will pass through your body and be detected by the scanner. Various drugs and other chemicals can be labeled with this isotope. The type of tracer used depends on what your doctor wants to measure. For instance, if your doctor is looking at a tumor, he or she might use radiolabeled glucose (FDG) and watch how it is metabolized by the tumor. Generally, SPECT radio tracers last longer in a patient and are primarily used in cardiology, where myocardial stress imaging takes about 3 to 4 hours. Meanwhile, PET radio tracers emit gamma rays with shorter lives and higher energies and are more useful in brain imaging, where scan lasts about 30 minutes.
For the next part, we will continue about the cancer treatment. Radiation can also be used in cancer treatment, as known as radiotherapy. Before this, we learned that radiation is used in X-ray that help doctor look inside our body, such as X-ray of our broken teeth or our fractured bone. In this treatment, only give us a lower level of radiation. But in cancer treatment, it involves high doses of radiation function as killer or delay cancer cell development. Therapy that cancer patient will get depend on their several factors such as the type of cancer, the size and the location of the tumor. Okay, the doctor need to identify either the tumor location is near to the normal tissue or not, because this normal tissue is really sensitive to the radiation. Okay, next, the doctor need to consider the general health, age, medical history also play an important role in determining which type of therapy that the patient will get. There are two types of radiation therapy that to treat cancer, which are the first one is external beam radiation therapy and the second one is internal radiation therapy. The external beam radiation therapy delivered by using a large machine. The radiation will go directly towards cancer with help of machines by aiming at the correct spot of cancer cells in body. The advantage of external beam radiation therapy is it treats a specific part of our body only. For example, if the patients have breast cancer, they will have radiation in their chest area only and not the whole body. Next, internal radiation therapy by using liquid as its source, or we can call it systemic therapy. This liquid will travel in our blood to tissue throughout our body. Cancer patients will receive the systematic radiation or liquid by swallowing, injection or through a vein and then shrink the cancer cells. Brachytherapy, or known as internal radiation therapy, use solid sources radiation as a medium. Solid sources radiation will be placed near the tumor location. Tumor will reduce in size as response toward that radiation. The type of internal solid source radiation include: the first one is permanent implant and the second one is temporary internal radiation therapy. Okay, we go first to the permanent implant. Permanent implant refer to a tiny steel seed that contain radioactive materials. The capsule are about the size of a grain of a rice. They deliver most of the radiation therapy around the implant area, but some radiation may exit the patient's body. This requires safety measures to protect others from radiation exposure. Over time, the implants lost radioactivity and the inactivity seeds remain in the body. Temporary internal radiation therapy. This is when radiation therapy is given in one of these ways, which is a tube that called catheter that carry fluid in or out the body. The radiation stay in the body for anywhere from a few minutes to a few days. Most of the people receive radiation therapy for just a few minutes. So they stay in a private room to limit other people's exposure to the radiation. During external beam radiation therapy, the patient does not become radioactive and the radiation remains in the treatment room. However, internal radiation therapy causes the patient to give off radiation. As the result, visitors should follow this safety measure. The first one is, do not visit the patient if you are pregnant or younger than 18 years old. The second one is, stay at least 6 feet from the patient bed. And the third one is, limit your stay to 30 minutes or less each day. For the permanent implant remain radioactive after the patient leave the hospital. Because of this, for 2 months, the patient should not have to close or more than 5 minutes of contact with the children and with the pregnant woman. Okay, now I will pass to the next presenter. The next presenter will present about the radiation risk.
All of us are exposed to radiation even though we did not perform radiation treatment for our health problem. For example, round-trip flight from New York to Tokyo, eating a banana and natural radiation doses from living at a sea level. Using radiation in medicine also has its drawback, or we can call it as a side effect. For instance, when we do a wrist elbow x-ray, we will get less than 0.01 MSV radiation and 4 to 6 MSV CT for CT or abdomen. But radiation in high doses can cause tissue damage and might contribute to a person getting a cancer later. This due to extremely high doses of radiation can lead to cell damage in human body. So, what happens if our cells are damaged? It will contribute to skin burn, hair loss, ulceration, and increased risk of getting cancer later. For example, people who get X-ray treatment will be exposed to radiation, and that radiation will be absorbed by their bodies. After that, it can cause molecular structure to be damaged and potentially harmful. However, that risk must be weighed against the benefit of obtaining doses of radiation. Okay, radiotherapy during pregnancy has the potential to harm the growing fetus. Pregnant women with malignant illness are generally advised to postpone radiation until after delivery. Between the age of 2 and 18 weeks, our baby is more vulnerable to radiation. Radiation exposure during pregnancy can indirectly slow the baby's growth and might bring about birth abnormalities. Numerous epidemiological studies of exposed population have shown that children are significantly more vulnerable to radiation. This is due to children normally expected to have a higher life expectancy than adults, right? Which means that they have a longer window of opportunity for radiation damage to manifest. If equipment setting and dosage are not modified for children's smaller body size, they may receive a larger dose of radiation than it is necessary. The most effective strategy to limit the patient risk in radiation examination is to perform suitable tests and optimize radiation protection for the patient. According to United States Environmental Protection Agency, exposure to low level of radiation does not cause immediate health effect, but can cause a small increase in the risk of getting cancer over a lifetime. There are studies that keep track of group of people who have been exposed to radiation, including atomic bomb survivor and radiation industry worker. This study shown that radiation exposure increases the chance of getting a cancer, and the risk increases as the doses increases. The higher the doses, the greater the risk. Conversely, cancer risk from radiation exposure decline as the doses fall. The lower the doses, the lower the risk. Okay, that's all from us. Thank you for listening.